doesn't stop with just dental, Deputy Speaker. The shortage of GPs in my electorate of Gilmore is critical. And that is why, Deputy Speaker, I fully support this amendment to the motion for second reading moved by the member for Ballarat, that all words after that be omitted with a view to substituting the following words. Whilst not declining to give the bill a second reading, the House urges the government to address outer metropolitan, rural and regional general practice sustainability and growing out-of-pocket costs for all Australians accessing general practice. Deputy Speaker, the GP shortage in my electorate of Gilmore is at crisis point. I want to point out that our local GPs and health workers provide the most amazing and vital support in our communities. They are the champions. They're every day at the forefront of primary health care, caring for people and going above and beyond in their care. They deserve to be supported more. But in the Bay and Basin area on the New South Wales South Coast, we have seen doctors retire, with the one remaining doctor at the Sanctuary Point Medical Centre retiring soon and no replacement in sight. The Minister says again, our area is not a distribution priority area. Apparently, according to the statistics, we have too many GPs. In fact, some of our GP practices have been calling to be made a distribution priority area for workforce shortage for some time. Take, for example, the Warragee Medical Practice, which had 13 full-time equivalent doctors, but now has 5. Some practices in the Bay and Basin area of the Shoalhaven have gone from bulk billing to private billing and have closed practices in order to consolidate. This has resulted in a net loss of GP appointments available to communities and poorer patient outcomes. It has placed enormous strain on remaining practices. Deputy Speaker, the system is broken. We now have a two-tier medical system where those who have lost their GP due to a practice closure, retirement and relocation of GPs cannot afford to pay private billing fees and have little or no access to a general practitioner. Deputy Speaker, constituents in the Sanctuary Point area contacted me recently about their very real personal stories about accessing a GP. These are their words. Nancy says, when my GP retired, I am at a loss. Being 94 years old, I need someone local. Not so. Was the same old story. Practices had too many patients on the waiting list. Some practices had their GPs retiring. Other practices were changing to women's health or COVID vaccine and testing. I feel very frustrated. Laurel says, my mother had to wait 10 weeks in hospital to be admitted to a nursing home because her doctor had moved and we couldn't find another doctor willing to visit her in the nursing home. Leanne says, and I quote, it makes no sense that at the very least, the number of doctors who have recently retired have not been replaced. It already took weeks to get an appointment before they retired, and now the wait time is longer. This is putting more strain on an already busy Shoalhaven Hospital emergency department. The area is increasing in population, not declining. The amount of GPs allocated does not reflect this. Wait for the sudden announcement of an increase of GPs just when they call the election, so they can take the credit and say, we were listening, we need more GPs now. Graham says the need for more doctors is an essential requirement for the Bay and Basin area of the South Coast, as the population is growing fast and it is also an ageing population. Estelle says, hope we can get more doctors here as it used to be. At the moment, it's like living in a third world country. Christy says, where have all the doctors gone? There is a gap and the Minister seems to be in denial. More and more subdivisions are going ahead with no infrastructure happening or even planned. I'm sure the numbers don't lie. So where is the Minister's head on this? Alan says, when our GP retired, it took us 2 months to find another and not local to me. Every practice was overloaded with new patients. In most cases, I was told one of the GPs at these practices anyway was retiring soon, or one practice was changing its focus. Christine says it takes too long to get an appointment because there are not enough doctors. Thomas says there are not enough permanent GPs. Lee says we desperately need more GPs. Tanya says, my doctor I had for years retired, and then I found out Sanctuary Point Medical Centre was shutting down. So I decided to try and find a new good doctor. When I finally seem to find a good doctor, the next time I go, they are gone. My whole family has been in a situation where we need to see a doctor. Every time I have tried to get into any doctor, there is a wait, normally a week. So we try and diagnose ourselves, and most of the time get better and forget about it. My worry is if one of my family members falls ill with something serious, we will not have one doctor that can see us straight away or that can get to know our family like our old family doctor. We need permanent doctors out here and more of them, as I am hearing from so many locals having the same issue, and they are really concerned about the current situation. Frederick says, I am in my 70s and reach that time when I am likely to need more regular visits to the GP. I was disappointed to hear that the Sanctuary Point Medical Centre had not been successful in replacing those two GPs who had resigned. I have a medical condition which requires ongoing observation and do not feel that seeing a new doctor every visit is providing the level of service that I would expect. Sanctuary Point is a marvellous place to live, and I don't see why it is so hard to attract young GPs to the area. As a younger man, I would have been very happy to work here and bring up a young family. There are many cases, Deputy Speaker, but one thing strikes me most as well is when a local GP comes to me for support, after having previously having their application rejected to employ a GP to work solely in nursing homes as part of their aged care program, supporting our most vulnerable. This program literally supports older vulnerable residents, ensuring they get the care when it's needed. This means less ambulance attendances, less emergency department attendances, lower demand on nursing home care workers, better coordination with discharge planning and outpatient services, especially palliative care. Deputy Speaker, we've had the Royal Commission into aged care. Isn't this the type of program and employment of GPs that the government should be supporting? And instead, it knocks back supporting it by rejecting the application to employ a GP. But it doesn't stop there. I'm at a loss why a local GP even needed to come to me about support for an application for a GP to work in a COVID clinic. It is beyond belief that that could actually occur. Deputy Speaker, there is so much that needs to be done to improve regional access to GPs. I'm pleased that Labor is listening and supported the new Senate inquiry into addressing regional and rural GP shortages. More than ever, the government needs to start listening to support our GPs, our health workers and our regional communities.